Hey y'all, we're gonna go through some tips regarding scanning the neck portion, whether it's soft tissue or a cervical spine, to look for fractures in the C-spine. Um, just be mindful that if they are wearing a collar, do not remove it. It's there for a reason. We're getting a scan to see if there's actually a fracture, to see if we can remove the collar. So don't remove the collar unless it's cleared. Different protocols for different facilities, so follow the protocol that you have for your facility. But just be mindful, like when the patient is laying down on their back facing up, if they can't go on the head holder, that's fine. Just lay them on the table. You want them on the head holder as best as you can because it keeps it secure. Sometimes when the head holder, the one that has a head holder, you want to change it to the flat one and not the one that with the bump for the actual head, because there's the flat version for a neck. The flat portion is so that there's no curvature here, so the neck is not up and that it's flat. And when you do your reconstructions from posterior to anterior or your coronal view, it's actually a nice perfect cut through the body of the vertebrae. So that's why you want to keep the neck as flat as possible and not elevated if possible. Some patients, they have to have their head up, and that's fine. If you can reconstruct it after, you reconstruct it and you get what you get, right? But I want to go back to the shoulders. Some people, they want to hold their hands like this, put their hands in their pockets, and that lifts the shoulders up high and it's blocking this. So you don't want the x-ray to shoot through the shoulders to get through the neck, right? So just remind them to lower their shoulders and relax. Even if they want their hands across, you can still lower your shoulders, even if they're laying down, because they want to be tense. They're scared that they're going to go into this little tube. Remember, be mindful about your patients and be patient, because sometimes they don't know what's going on. They're injured, they're in pain, this is new to them, and it's just great to just communicate and be patient. That way you get a great scan, and that the scan is pretty quick so that you don't have to repeat anything, and just the flow gets a little bit better when you communicate, right? So just remind them to relax the shoulder, bring their shoulders down. That way it's not so much mask and going through the neck. So what else? A necklace, of course, jewelry has to be removed unless it's like plastic or whatever. I leave it. Sometimes earrings can get in the way, so just be mindful of that. Dentures, if they have it, you can take it off. Sometimes it doesn't cause that much artifact, but some places don't like any artifacts in the area at all, so that could be removed. Normally, you want to aim for the EAM. A lot of the times depending on the facility, you zero it out at the EAM or top of the ear or bottom of the orbit or top of the orbit. It depends on how far up or how far down the facility wants. Sometimes they just want it from like EAM to like T2, and that's your C-spine. Some places want top of the orbits for a neck. They want top of the orbits. This is soft tissue neck. So they'll scan top of the orbits all the way to the top of the aortic arch. And some facilities don't do that. So just depending on where you go, just know where you're supposed to go for whoever you work for. Sometimes there's breathing instructions. They just don't want the patient to swallow when we're scanning. So that's some of the breathing instructions for necks. Stop, don't swallow, hold still, don't swallow. And of course, that's just to reduce motion. CT angios are another thing, still remove. Remember, in angio study, you have to have 20 gauge IV recommended on the right arm because of the blood flow into the heart, so that there's no artifacts from contrast going the opposite way. And that way you can trigger through depending on how fast or slow your scanner is. The trigger mark will be in the aortic arch area. Sometimes it's in the middle if it's slower. And sometimes people scan from top to bottom or bottom to top. That just depends on the facility. Every facility is different, so try to follow along. And I know that's not helpful, but literally follow your protocol, and that's all you can do. They get what they get when you follow the protocol, and you can't be wrong if you follow the protocol. So yeah, hopefully that was helpful. If you have any other tips or tricks, please leave it in the comments and help each other out. All right, take care. Toodles noodles, stay safe and stay rad.